You're still watching Joy News Desk here on the Joy News channel. Now, Star Ghana Foundation, in collaboration with Joy News under the Partnership Beyond Aid project, brings you the 2022 budget for health and education services delivery in a COVID-19 pandemic era forum. The keynote address will be addressed by Professor Haruna Isaku, Associate Professor of Applied Economics and Finance at the University of Development Studies. Winston Amwa is ready to take over now.
Focusing on the 2022 budget, I know there are many of you who've been discussing some of the proposals in the 2022 budget. A lot of you have been concerned about the e-levy. But for the Star Ghana Foundation Forum this morning, the focus is on financing, education, healthcare and social protection within a COVID-19 pandemic, the 2022 budget in perspective. My name is Winston Amwa, and we're grateful that you've made time to join us. We'd invite the Executive Director of the Star Ghana Foundation, Ibrahim Tanko Amidu, to give us the welcome address with a round of applause.
Distinguished ladies and gentlemen, it's my pleasure and it's to welcome you all to this forum. I do this on behalf of the Governing Council of the Star Ghana Foundation. Star Ghana Foundation, as most of you would know, is a national center for the promotion of active citizenship and local philanthropy to achieve inclusive and sustainable development. We do this through what we call our signature 3 C's and L approach, convening inclusive dialogues around key national and local issues, helping to catalyze actions to achieve inclusive development, and facilitating coordination of these actions. So this dialogue is part of our 3 C's approach under the Partnerships for Beyond Aid project, which is funded by the Foreign, Commonwealth and Development Office of the UK government. The Partnership Beyond Aid project aims at helping to achieve inclusive access to quality public goods and services, particularly health and education. Improving access to quality public goods and services, in our opinion, should start with the budget, because the budget, the national budget, serves as an important tool for financing our development programs, priorities, and policies. Issues around how resources are allocated, what gets allocated, what is released, what is it used for, how we monitor the implementation of the implementation of the budget, and what is achieved at the end of the day are parts of the process of monitoring the budget or using the budget as a tool for achieving inclusive development. Achieving all this would require citizens' access to information, to influence, to monitor, to engage, and to hold accountable. And it's within this context that today's dialogue is taking place. We have assembled an experts group of Ghanaians to help us start that journey of using the 2022 budget as a basis for achieving inclusive development. We have, and I'm sure they'll be introduced in greater detail at the right time, but just to mention that we have Professor Haruna Isaku of the University of Development Studies as the keynote presenter. And then we have Madam Harriet Ajiman of SEND Ghana, Mr. Kofi Asari of Africa Education Watch, and Professor Ekuya Nyidoho, the Director of a Center for National Social Policy Studies at the University of Ghana, as the discussants. We look forward to a constructive conversation around the budget and also working with you post this conversation towards achieving or realizing the recommendations from this. I would like to thank all of you for coming and to acknowledge our media partner, Multimedia, for their partnership in putting this together and implementing. Thank you once again for coming, and God bless our homeland, Ghana. Thank you.
Thank you very, very much, Mr. Ibrahim Tankwamidu, for welcoming all of us to this very important event. And he set the tone for the commencement of discussions. And as already indicated, it's important for us to find out, the allocations for these key sectors in the 2022 budget statement. As we compare that to the 2021, find out also what percentage is dedicated to recurrent expenditure and that which is dedicated to capital expenditure. Talking about education, talking about health, for instance, particularly with health, we know Agenda 111. Many of you know that particular, promise by the government in building 111 hospitals. So in the 2022 budget, for instance, what are the allocations to the health sector? What percentage goes into capital expenditure? And capital expenditure would take care of Agenda 111. What percentage goes into recurrent expenditure? And so if we look at the capital expenditure, can we say that we're on course when it comes to building 111 hospitals? When it gets to education, also would find that, and we'll compare that to global standards and what we have signed on to as a country. And we will start the conversation with a keynote speaker. Now, he's a professor, an associate professor in applied economics and finance and head of the Department of Economics and Entrepreneurship Development, University for Development Studies, Ghana. He holds a PhD in finance from the University of Ghana Business School. And he's an international visiting scholar at Coventry University, Nigeria. He's a development finance expert whose current research focuses on remittances, digital finance, financial inclusion, agricultural finance, and inclusive development. He has over 18 years of teaching, training, community outreach, and research experience. Ladies and gentlemen, with a round of applause, let's welcome Professor Isahaku Haruna, who is our keynote speaker.
We have before us at this moment is to consider the 2022 national budget allocation to health, education, and social protection sectors. And that is very crucial because these sectors have assumed some importance following the devastation caused by the coronavirus pandemic. So we would take our time to look at the allocations and what they mean. Now, the presentation will look at the highlights of the 2022 national budget, the budget priority issues. Then we also assess the adequacy of the allocations to education, health, and social protection in the 2022 budget. Then we would also look at the equity dimensions of the 2022 budget with regard to health, education, and social protection. Then we would end by looking at some key recommendations. Now, ladies and gentlemen, national budgets are the main conduits through which government policies and priorities are financed. Therefore, continuous and ardent scrutiny of government budgets will be very imperative. Why? Because this will ensure that government is put on its toes to properly align policy objectives with planned spending. Not only that, but the success of the Sustainable Development Goals will depend to a very large extent how well they reflect in national budgets, as well as how efficiently the budget allocations to those goals are executed. And the pandemic has wreaked a lot of havoc in health and education. And in particular, we know that within the education sector, the pandemic has led to the disruption of academic calendars. It has put health and educational facilities under serious pressure and changed government priorities, because now COVID-19 expenditure feature very greatly in government plans. But prior to 2020, this was entirely not the case. And COVID-19 has further slowed down economic growth in Ghana very considerably, leading to the tumbling of GDP from 6.5%, GDP growth from 6.5% in 2019 to somewhere 0.9% in 2020. And monitoring data following the pandemic by UNICEF Ghana and Social Policy Research Institute in 2020 showed that for JHS school pupils, the pandemic and its attendant induced school closures led to about 39% of households complaining that they lacked access to basic tools such as computers or mobile phones in order to enable their pupils or children to study. Then again, 33% did not have access to learning materials, including textbooks, following COVID-19 induced lockdown. Now, for senior high school students, the constraints they face following the pandemic include, among others, lack of access to learning equipment, and about 45% of households indicated this as an obstacle to learning. Then also lack of textbooks. About 27% or 28% of households indicated this to be a problem for their SHS students to be able to learn. Then also 26% lacked access to the internet to be able to download learning materials. Similarly, COVID-19 has exposed the weaknesses in Ghana's health system in handling medical emergencies. In particular, we can talk about inadequate quarantine and isolation centers in a number of regions and districts, also weak coordination structures, the coordination of contact tracers and other personnel was a huge challenge, and it exposed weaknesses in laboratory structures and erratic laboratory and drug supplies. And if you look at the impact on economic vulnerability, studies show that before the pandemic, the poverty rate was around 20.5%, but with the onset of the COVID-19, the poverty rate increased to around 34% in 2020, which means that some new poor people would be recruited due to the pandemic. Now, let's look at some highlights of the 2022 budget. The main macroeconomic targets that the 2022 budget hopes to fulfill include ensuring that we attain real GDP growth of 5.8%, non-oil real GDP of 5.9%, and then also to ensure that inflation rate ends the year with 8%. We know that at the moment is around 11%. So government is hoping that prices would come down, general price levels will come down, and then we can attain 8% of inflation by end year. Then a fiscal deficit of 7.4% of GDP is envisaged, and then government hopes that it can have international reserve cover of not less than 4 months of import cover. Now, if you look at the budget in terms of the fiscal operations of the central government, you would realize that from the start, government is running a deficit budget, and this is the case for most developing countries where their needs far exceed their abilities. So you can clearly see that government is hoping to raise about 100 billion Ghana cedis in 2022. Meanwhile, it plans to spend about 138 billion in the same year, which leaves the deficit to be around 37 billion Ghana cedis. So this 37 billion Ghana cedis, government will have to find a way of financing that. And government is proposing that it would take, it will raise about 28 billion from domestic sources and then go to the international finance market to obtain about 4.5 billion, and then also draw on the exceptional financing being IMF special drawing rights of around 4.5 billion in order to run the budget. And it is hoping that nominal GDP will be somewhere around 502 billion. Now, that said, let's look at the prioritization in the 2022 budget. Now, the budget contains about 7 priority areas. And top among them is COVID-19 containment and vaccination. And of course, this is no surprise because that is the challenge that we are all facing at the moment. Government also wants to, embark on fiscal consolidation to strengthen the economic fundamentals and manage debt more sustainably as the second priority. Now, the third priority is important for our discussion because it looks at continual revitalization and transformation of the economy to build forward better through the Ghana Cares program, and then government flagship programs, and then Agenda 111. Now, there are others, but if we move on to the seventh one, which looks at social interventions programs, including housing, training, and retraining. And then we have the LEAP, which is also of concern to us. Now, if you look at these 7 priorities, health features strongly in priority 1, which is COVID-19 related, and then also it features in priority 3, which is focused on, among others, Agenda 111, and then some government flagship programs. Now, though education is not mentioned directly as a priority, but it is subsumed under government flagship programs. So if you look at the details of the budget, the free senior high school policy is part of the flagship programs, as well as teacher trainee allowances. So these are basically that with regard to the health sector, the focus is on the COVID-19 containment measures, vaccination issues, and then in terms of infrastructure, center on free senior high school and then teacher trainee allowances. And I would highlight that these two will largely address issues of affordability and access, but not quality per se. Now, in terms of social protection, the main priorities which are captured under the flagship programs are LEAP and then also the school feeding program. Now, apart from the main budget item in terms of prioritization, the annual budget funding amount has 12 priority spending areas, and education and health are treated together jointly, or they are treated jointly as a priority. Now, and within that, once again, the priority is the free senior high school, and then science, technology, engineering, and mathematics centers. Now, for health, the ABFA focuses on health infrastructure and then also the implementation of the e-health program. So these allocations have some quality dimensions, but we would see that they largely tilt towards access. Now, what are some of the issues that arise from the prioritization done by the government in the 2022 budget? The key one is that with the introduction of the free senior high school program, we see a shift in attention by government to secondary education to the disadvantage of basic education. And that, therefore, is then reflected in government's flagship programs, where the focus here is on the free senior high school policy. And coming through the budget, you would find that the all-important issue of lack of textbooks to go with the new educational curriculum that was introduced 2 years ago has not been given special mention in the 2022 budget. Apart from that, if we look at the medium-term expenditure framework of the Ministry of Education, which covers 2019 to 2022, you would realize that the current prioritization and spending trends in the educational sector will not enable the achievement of the MTEF in 2022. Why? Because if you look at the data The medium-term expenditure framework tried to achieve some indicators at the basic level, particularly I'm talking about GHS, to improve gross enrollment rate at least from 95% in 2008 to 96% in 2022, and net admission rate from about 74% in 2008 to 95% in 2022. And then also the completion rate from 86% to 95% in 2008 to 95% in 2022. However, when you look at EMI's data for 2019-2020 academic year, it tells you that the gross enrollment rate, the net admission rate, and the completion rate for GHS were respectively 82%, 38%, and then 76%. And all these are lower than the baseline values, that is 2008, which tells you that these indicators are fallen rather than increasing in line with projections made in the medium-term expenditure framework of the Ministry of Education. Now, let's look at the extent to which the allocations are adequate in addressing needs in education, health, and social protection. Now, let's look at education sector allocation first. In 2015, member states of UNESCO agreed that they will spend between 4 to 6% of their GDP, or alternatively 15 to 20% of public expenditure on education in order to improve education. Now, so given this benchmark, we can now look at the allocations to the education sector between 2001 and then 2021 and then 2022, so that we can see whether Ghana is on course to meeting this threshold of 4% of GDP spent on education. In 2021, the amount allocated to the education sector was 15.6 billion Ghana cedis. This increased by 14% to settle at 17.8% in the 2022 budget. Now, so the change is about 2.2 million Ghana cedis. So 2.2 million Ghana cedis more is added to 2022 budget. That is additional to 2021 budget. Now, as of 2021, the allocation represented 3.6% of GDP, and in 2022, this had fallen very marginally to 3.5% of GDP. Comparing that to the UNESCO threshold, you see that we are not there. We are close to the minimum, but we are not there yet. If you look at the allocation in terms of percentage of government spending that goes to education in 2021, it is about 13.7%. And this declined marginally to 12.9% in 2022, which means that if we use that indicator also, we are not within the UNESCO threshold of spending at least 15% of public expenditure on education. Now, what does this imply? What it means is that the allocation that goes to the education sector is not increasing alongside increases in the gross domestic product. So your income is increasing, but the amount that you allocate to education is not increasing as much, though it may appear in nominal terms that it's increasing. But if you compare it to how much you earn, then you realize that you are not doing as much as you should be doing. Then it also implied that Ghana not being able to meet the UNESCO minimum threshold of spending 4% of GDP on education could have implications on the quality of education, access to education, affordability, among others, and by translation, will have an impact on the quality of the human resources that we produce as a nation. Now, if you look at the breakdown of expenditure in the education sector, you see some skewness. And of course, that skewness is not so surprising, because there are a lot of teachers that have to be paid. So we see that out of about 17.8 billion allocated to the sector, about 84% goes to headquarters and agencies under the ministry for the payment of wages and salaries. In most part, that goes to free senior high school. Of course, in line with the fact that it is a priority of the government. Then you are left with 1% for existing interventions in education, which is around 175 education, among others. So we clearly see how resources are squeezed in terms of primary, consumes about 241 or 242 million Ghana cedis annually. And you would see that in terms of the value, it is greater than the amount. So it raises, once again, that vexed issue of whether we should continue to spend on teacher trainee allowances, given that the health sector. But then if you look at the data, the 2022 budget allocates 11.5 billion to the health sector. And this is just 8.4% of the budget, which means that we are just about halfway through the Abuja Declaration. So we are far from meeting international thresholds in terms of how much we spend on health, even with the introduction of Agenda 111. And then also the extra spending in the health sector induced by COVID-19. If you allocated to the sector, if you look at the computations, it is just around 0.2% of GDP. We know the size of the sector is not that big compared to other sectors. Now, if under the ministry, we will see that the allocation to that sector jumped from 880 million in 2021 to about 1.1 billion in 2022. This shows about 34% increase over the previous year. And this increase in allocation is largely driven by an increase in the allocation to the school feeding program, which was allocated 881 million Ghana cedis in 2022, as against 489 million in the 2021 budget. If you look at the breakdown of the allocation to the Ministry of Gender, Children, and Social Protection in the 2022 budget, you would realize that unlike the Education and Health Ministry, they don't have a lot of expenditure at the headquarters and then the agency level. So the allocation to headquarters and agency level for salaries and wages and some amount of capital expenditure is just 5% of the allocation to the sector. LEAP takes about 17% of the allocation. School feeding program is the largest beneficiary here, taking about 77% of the allocation to the sector. Now, the point to make here is that the medium-term expenditure framework for the Ministry of Gender, Children, and Social Protection envisages that in 2022, it will reach about 350,000 households with the LEAP program. But if you look at the allocation to LEAP 2021-2022, there is no change, which means that government can only cater for the number it did in 2021. So then, there is no change in the coverage of LEAP, which means that the medium-term expenditure framework target of reaching 350,000 households in 2022 will not be met. So a gap of about 5,977 households will remain. But with the pandemic producing new poor people and creating further vulnerabilities, the actual gap will be more than 5,977 households. Now, let's consider the equity dimensions of the allocations to education, health, and social protection in the 2022 budget. The issue of equity in the allocations is sensitive to how we address geographical disparities, how we address disparities in terms of people with special needs or people that are abled differently. How do we seek to include segments of the population that are isolated, marginalized, and deprived? Now, if you look at the allocation to the education sector, it clearly indicates that government's aim really is towards ensuring equality of opportunity and resources, and not necessarily ensuring equity. Or if you look at all the programs that are listed in the budget, they are, most of them are focused on providing for all without giving special attention to specific segments of the population within the educational sector that need special attention. So if we look at the allocations throughout all the levels, we don't see any special allocation that would tend to bridge the North-South gap in terms of education, gender gap in terms of educational inputs and resources, and then also addressing learners with special needs. So government needs to pay attention to allocating resources to disadvantaged geographical areas, and then social groups such as student mothers and learners that have special needs, so that we can have them taking part of participating effectively in the development process. Now let's look at equity issues in the education sector. Further, so if you look at it, the very important equity issue that I find in the education budget is that it seeks to address the needs of special learners by trying to design the standards-based curriculum and common core curricula so that they can suit the needs of persons who have special needs, and that is very commendable. But if we take a closer look at the allocation to the education sector, we would find that 67% of allocation to the sector goes to compensation of employees. Then we are spending 25% on goods and services. So what is now then left for school projects and facilities is just 8% of the allocation to the education sector. Given that per the Ghana Revenue Authority laws, capital allowance for buildings, for instance, is 10%. It means that if we were really going to be undertaking routine maintenance of facilities, even this 8% would not be sufficient to maintain our schools. And little wonder when you go to a number of the schools, you ask the heads, they would not remember the last time school buildings saw any renovation or upgrade. Now, if we look at equity in the health sector allocation, we will see that the health sector seems to be more sensitive to equity issues and inclusiveness as well. And there are some examples in the budget that are worthy of mention here. One being the proposed establishment of mental health tribunals so that they can handle the abuse of mental patients, which has become a very important issue. Then the setting up of 2 committees to finalize strategic documents to attract and retain health workers in disadvantaged areas. I think this is a very important move. Of course, hopefully those committees will not turn into a conjunctive. But it is something that is worthy of mention. Then the envisaged establishment of 3 mental hospitals under Agenda 111 is commendable, as well as 101 district hospitals also under Agenda 111, so that this will cater for districts that do not have hospitals. If we look at the allocation to the health sector, we find that 59% goes to compensation of employees, so 57% goes to the compensation of employees, that is wages and salaries, 22% to goods and services, and then 21% to capital expenditure. So in terms of capital expenditure, we see that the health sector is doing better than the education sector in terms of how much they allocate to capital expenditure. But then, a major equity issue that we need to consider in the health sector relates to the prioritization of hospital facilities rather than cheap compounds or primary health care clinics and facilities in terms of capital spending. We know that the cheap compounds and then clinics are more accessible to the vulnerable and deprived portions of our population. So they need to be highlighted and given attention if we really want to improve upon access of our rural and then disadvantaged population to health facilities. But another equity issue that needs mention under Agenda 111 that needs clarification is that it is not really clear when government intends to complete Agenda 111 projects. And if you look at paragraph 383, that is found in on page 94 of the 2022 budget, it says that the Agenda 111 is expected to be completed by end 2023. But then if you go to the appendix, you would find that in that same budget statement, the allocation to Agenda 111 is through to 2025. So there's some disconnect here. So is it that government is going to finish the projects in 2023 and then accumulate areas and pay them up to 2025? So there is the need for a clear explanation as to when the projects will be completed. Apart from that, as I mentioned earlier, the amount allocated even up to 2025 would not be able to achieve 111 hospital projects. Now, if we look at equity issues in social protection, we'll find that in terms of the allocation to the gender ministry, we find goods and services taking a chunk of the allocation, that is 96%. And then we have compensation of employees taking about 3%. So the amount spent on capture projects under the ministry is negligible, so about 1%. But then, as I mentioned earlier, there's no change in the budgetary allocation to the LEAP program, which means new poor people that have arisen as a result of COVID-19 would not be enrolled onto the LEAP program, which is something that government needs to act on in order to reduce vulnerabilities within the context of the pandemic. Now, before I go to recommendations, the question is, how credible are our budgets? And when we talk about the credibility of a budget, we'll be looking at what did the budget say it would do, and what did it do? So the budget said it will allocate A, but did it really release funds to the tune of A? And were those funds utilized to the full amount of the allocation? So if we look at the 2022 budget, the allocation to Agenda 111 once again gives some reason for concern. If you look at the allocation in the 2021 budget, you will see that initially government allocated 1.5 billion Ghana cedis for Agenda 111. But in the mid-year budget review, it was revised downward to 779 million Ghana cedis. If you look at the utilization, you would find that only 36.4 million out of the 779 million was released as of September 2021. This is about 4.6% utilization rate, which is too low, too low. It would be a miracle for government to allocate the remaining 94.4% between October and December, which suggests that there's a reason to worry here. Now, if you look at the benchmark for determining whether a budget is credible or not, the benchmark is that the deviation between approved budget and then paid actual should not exceed 10%. So if you look at what was approved and what was paid, the difference should not be more than 10%. But an examination of GiveMe data from 2015 to 2018 suggests that with the exception of 2017, for all the years, the deviation far exceeded the 10% benchmark for all the other years, 2015, 2016, and then 2018. If you look at 2015, for instance, the deviation between approved budget and releases was up to 41%. So from then it started coming down, but as of 2018, it was around 31%. Now, so given this, what are some of the key recommendations that I will put forward for the government and other stakeholders to consider? So starting with the education sector, we would recommend that government should consistently increase educational sector spending so that we can meet the UNESCO threshold of 15 to 20% of total budget expenditure in order to improve education. Secondly, we recommend that the government should seek to create a balance in terms of allocating resources among the various levels of education. So we're talking about basic, second cycle, and then tertiary. There has to be a balance so that we don't leave some levels of the educational sector behind. Then, for proper analysis of allocation to the sector, the Ministry of Education should provide disaggregated expenditure in the education sector to assist in assessing expenditure trends, resource use efficiency, and spending gaps. We also recommend that the Ministry of Education should view the introduction of textbooks for the new curriculum as a national emergency, because 2 years running, no textbooks to match the new curriculum. The ministry's excuse has been that resource packs have been provided, but they cannot be substitutes to textbooks. We also recommend that the ministry should provide a definite timeline for introducing these textbooks. Furthermore, the Ministry of Education should consciously seek to address inequities in the educational sector when allocating resources in 2022 and beyond. And I would also recommend that the Ministry of Education must seek to balance the allocation among capital expenditure, goods and services, and then compensation of employees. And for the health sector, I would recommend that health spending must be increased progressively so that we can achieve the Abuja Declaration of appropriating 15% of annual budget to improve health. Then, government needs to do more in terms of financing. And here, it has to more than double the allocation to Agenda 111 if it aims to complete the projects by 2025. And this will require government rallying donor support around the Agenda 111 so that it can mobilize funds to prosecute this noble dream. The government should also clarify the timelines for executing Agenda 111 and then allocate resources in line with the timelines. I also recommend the allocation of resources towards CHIPS compounds and primary healthcare clinics and facilities so that we can improve access to health services by disadvantaged portions of our population. And COVID-19 still being around, refusing to go, there's the need to devote more health spending to infrastructure to improve access to healthcare services, especially in areas that are hard to reach. Then, in terms of social protection, I recommend that the government should reallocate resources to LIFT in order to meet the medium-term expenditure framework target of reaching 350,000 households in 2022, and then also to cater for pandemic-induced poverty and vulnerabilities. And then also there is the need for government to try to complete the process of enlisting LIFT beneficiaries onto the National Health Insurance Scheme. And in terms of ensuring budget credibility, I would recommend that government has to improve the accuracy of revenue forecasts as input into budget statements so that there will not be so much deviation between approved actuals and then releases. Government should also do the budget estimations based on allocations on historical trends in budget utilization. And then also government should seek to properly align releases to approved budgets. Thank you very much for your attention.
Thank you very, very much, Professor Isahaku Haruna. This is a well-researched presentation. We are very, very grateful to you. Let's give him another round of applause. And the good thing about the recommendations are that, they summarize all the things and the challenges that we have seen in the 2022 budget when it comes to social protection, education, and health. So we're not going to go back to summarizing them, but we're continuing with a panel discussion on what Professor Haruna has presented to us. And to help us have this all-important conversation, we've assembled a team of 4. And they're the persons who understand these areas, and thus would be able to help us further interrogate some of the issues that Professor Haruna has raised. First is Nana Ekuya Anyidoho, who is an associate professor at the Institute of Statistical, Social and Economic Research and director of the Center for Social Policy Studies, both at the University of Ghana. Now, she works in the areas of social policy, social development, and frequently explores themes of participation, inclusion, and empowerment by examining how marginalized social groups, in particular young people and women, interact with social policy structures and processes. Let's welcome her with a round of applause. Thank you very much, Nanekia, for joining us. Our next panelist is Kofi Asare, who is the Executive Director of the African Education Watch. Now, Kofi is a global education policy influencer with 20 years of experience in the education and skills sector of Africa, working with schools, communities, international organizations, industry training providers, government agencies, and civil society organizations in the development, management, and review of education and skill policies and programs, including agriculture. Let's welcome him with a round of applause. Thank you very much, Kofi, for making time to join us this morning. Our next discussant is a development professional with over 17 years of progressive experience in project design, implementation, and advocacy with a focus on policy research in the last 9 years. She currently serves as a senior programs officer with Send Ghana with the responsibility of conducting policy research, budget tracking and analysis, and supervising civil society-led participatory monitoring and evaluation of pro-poor government policies in health, education, and social protection. Let's welcome Harriet Nuema Ajiman, who is Senior Programs Officer of Send Ghana. And our final discussant is an Associate Professor of Economics and Dean of International Programs of the University of Ghana, a former head of Department of Distance Education. He's also a Senior Research Fellow at the Institute of Economic Affairs and a non-resident research fellow at CEQ Institute in the United States. He holds a PhD in development economics and also is a postgraduate scholar from the Brown International Advanced Research Institute at the Brown University, where he studied development and inequality in the global South. Let's welcome Professor Eric Osesibe. All right, so ladies and gentlemen, thank you very much for joining us. We go straight into the discussion, and would like to start off with your general thoughts about the presentation by Professor Isahaku Haruna. I'll start off with you, Nanekia. What do you make generally of everything that Professor has talked about?
Well, first of all, I very much appreciate Professor Isahaku's detailed analysis, which I think gives us a very good starting point for this discussion. The aspect of the presentation that I want to focus on to begin with is the fact that we are consistently underspending on health and education, as he pointed out, below the minimum levels that we ourselves have committed to internationally. And I think essentially that is because of the way that we conceive of social policy and social development relative to economic and fiscal policies and economic development. We are still on a trajectory, I guess since the 1980s, of being very preoccupied with economic growth as the focus and the driver of general development, even though we are now, and especially researchers of social policy, have now reached a consensus that social policy and social development, of which social protection is just one aspect, that these are the drivers of social progress. And in particular, in periods of crisis like the one that we are going through, these periods of crisis demand that we truly put people first. And putting people first means that we are investing seriously in education and health, among others. Education matters at all times, but particularly in periods of crisis, education can help us to innovate and find solutions through learning and research. Health is important because human lives are to be protected for their inherent value. but we also need to preserve the people who we hope will rebuild the economy that we all rely on. And if we don't deal with these sectors, we won't be able to do the other things that we are hoping to do with youth entrepreneurship and private sector growth and
Yes, it's working.
and Agenda 111, which will require healthcare professionals at all levels. So I just want to have my preliminary comments be sort of a more contextualizing comments about the ways in which our expenditures in the areas of social policy, which does include education, health, and social protection, as well as housing and work and so on, shows that we fundamentally do not believe that people are our biggest development investment. And I think that that is an orientation that we need to change if our budgets are to change. So that will be my starting comments. Thank you.
Thank you very much, Nanekia. Let me get to you, Kofi Asare. What are your opening remarks following the presentation by Professor Haruna Isahaku?
Thank you, Winston. And once again, good morning to our audience. I think it was a well-researched presentation, well thought through, looking at the various dimensions and implications of the budget, especially the angles of equity and inclusion that are key. Linking the budgets and then the targets in the medium-term expenditure framework and equitable, the lack of attainment for the equitable indicators is key. It tells us that we are deploying, but in respect of the deliverables, the targets set for ourselves within the medium-term expenditure framework, the financing is not yielding the required results, on the scale of equity. Going beyond the national level, obviously, will give you a fairer picture instead of relying solely on national level data. But a specific thing I picked from his presentation, which is very revealing, and I see as a challenge, but most importantly as an opportunity, is the reduction in the personal emolument budget of the ministry. We have reduced the allocation for salaries and personal emoluments by almost 10 percentage points from 76 to 67. And the challenge here is that even within the 76, prior to the reduction, last year, this academic year, we've had for the first time in in a long time, we've witnessed about 34,000 teachers leaving the classroom in just primary and junior high schools. We've lost about 34,000 teachers out of the classroom, and that is an attrition rate of 15%. And confronted with the challenge of recruiting more teachers to replace this 34,000, obviously a reduction in the personal emolument budget means that it will be difficult. I have seen the clearance from the Ministry of Finance. It came about a couple of weeks ago, and I think we are recruiting, about 16,000 or 17,000, but we've lost 34,000. That's about half. That is the challenge. The opportunity is that we have a tremendous oversupply of teachers in many districts. In a Adenta district, for instance, there are more than 250 teachers in Adenta's primary school that are absolute surplus to labor requirements. Can you imagine more than 320 teachers teaching just 18 primary schools, 18? So the opportunity is that the Education Ministry and engineers will have no option than to think outside the box and innovate on how to redeploy and rationalize teachers and ensure that teachers needed in Zabzugu and Nkwanta South, for instance, are shipped from Adenta to where they are needed. So that is the opportunity I see within the challenge.
Thank you very much, Kofi. Let me get to you, Harriet.
Thank you very much. And thank you, Prof, for that insightful presentation. But as I sat and listened, I asked myself, what more to say? What else do we have to say? Because that was a very detailed one. And so thank you very much. But I want to focus my initial comments on budget credibility. I think this has become an issue that is not just for 2020, but also in past years, budget credibility has been low. That is to say that government does allocate the funding, and we all listen to it on the floor of Parliament, but at the end of the day, the funds are not released for the intended purposes. And I ask myself, are we unable to mobilize the revenue that we have targeted? Most often we attain our targets. Even in 2020, when we thought that COVID was a challenge, we were able to mobilize more than the revised targets that we set as a country. But this was also the very year that the core sectors of education and health did not receive the expected amount in terms of actual releases. So for example, in the health sector, in 2020, they got 47.6% less of what has been allocated them, even the revised budget. For 2020, health had a revised budget upwards because of COVID-19, but they received that less for implementation. Also in education overspent its resources by about 7%, and all that went into compensation, even taking some from goods and services as well as capital expenditure to compensation. And so in education sector 2020, we spent 24% less than what has been allocated to goods and services, and 35% less of what was expected to go to CAPEX. And so the question is, where lies government's priority in terms of spending, in terms of implementation? And I think that probably we need to focus more on this area in terms of advocacy to get and to draw government's attention to the fact that it is inadequate to just allocate. It is very important that whatever is allocated is released, especially when the resources are actually mobilized. We get our revenues. We always hear GRA exceeding its target. But then when it comes to implementation, maybe some other things get the attention of government behind the scenes, and we are not aware of. We think that our government should make our budget more credible by releasing the resources for implementation of very important interventions for our people. Thank you very much.
Thank you very much, Harriet. Professor Sesibe.
Thank you. I also wish to add my voice to what my predecessors have said by thanking Prof for a very insightful presentation. I mean, for me, if coronavirus has taught us any lesson, it is the fact that really there is some silver lining in the midst of dark clouds, which is that development from hence has now become more of human-centered in every possible way. And so that is why I'm quite excited about this forum, because we know, I mean, there's enough evidence to show that human capital actually drives economic growth and sustainability of many countries. And therefore, broad-based an educated workforce often is very much linked with the productivity and competitiveness of any country. We have seen examples in South Korea, in East Asia, China, Japan, and all of that. So this is critical for our development. But as Prof was outlining the policy recommendation, what actually struck me was, I mean, these recommendations were very fine. I mean, the fact that we need to meet the Abuja Declaration, the UNESCO threshold, increasing expenditure on LEAP, and all of that. I think that we also have to look at the other side of the coin by putting it within the context that Ghana government or the finances of the country finds itself in, so that when we are giving a recommendation, we know the national envelope and how much it can actually take in that regard. So if you look at the Public Financial Management Act at 921 and then the Fiscal Responsibility Act at 982, there is clear guideline and numerical limits to which government can spend. For example, the Fiscal Responsibility Act, which gives a ceiling of about 5%. We've seen the disruptions that the coronavirus has brought, which then mean that government fiscal deficit had to increase consistently over the last couple of years. Now, this really has led to increases in debt, and the debt has actually mounted to the extent that interest payments alone takes about 31% of government total expenditure and about 55% of tax revenue. So clearly, you can see the fiscal constraint that our finances find itself in. And so I wanted to see the presentation touching on all these fine ideas. I asked myself, how can government create fiscal space within the limited fiscal constraint to be able to spend on Agenda 111, to be able to upskill social protection, especially LEAP, which touch the very poor, or the school feeding, and all of that without compromising our fiscal sustainability. So I'll end it here, and then as we move on.
And let me just continue with you, because you've talked about the fact that it's very important, even as we talk about all of these, we also look at the circumstances within which we find ourselves. We also look at the effect of COVID-19 on revenue generation and its increase in expenditure, for instance. But you would agree also that government being mindful, and I mean, the percentages that Professor Haruna talked about in relation to GDP and also in relation to the budget. So let's look at the health, for instance. When the president addressed the nation last year, in one of the addresses, one of the things he said was that COVID-19 has taught us that we should improve our health infrastructure. The president makes the point that it was going to, the construction of 111 hospitals was going to start in 2020 and was expected to be completed within 1 year of commencement. Now, when you make this bold statement, one would expect that your financials would suggest to you that you can do it. Professor Sesibe. So, yes, you can say the financials, we have a challenge, but the managers make statements. They make promises which we expect them to make based on our financials, shouldn't they?
Yeah, I mean, you're very right. I honestly wouldn't want to veer into that kind of situation. I want to look at the numbers. I mean, for me, there's no way that is attainable, given that the situation that government finds itself in. The budget as it stands now, you look at Prof presented to us compensation. One thing that he didn't touch on is interest payment. That is the loan that we have collected. And then if you look at transfers to statutory organizations, these three alone, 2021, constitute 146% of our tax revenue.
Sure.
Which means that to pay for this non-discretion expenditures, government have to borrow about 46% more than the tax revenue that we collect. So obviously, there is no space at all for government to be able to say that it was going to spend about, what was the figure, about 10 billion or so Ghana cedis to finish Agenda 111. To me, much as it is a good policy,
I think that we shouldn't also overburden the fiscal, which will mean that we have to overburden the people, or we have to go and borrow more, which often has a vicious cycle on your expenditure and your fiscal deficit and your debt accumulation. And so I would take that as a political talk, but in reality, on the ground, there is no way we will be able to do that. And I would even not advise government to do this within the next 5 years. Otherwise, we'll break the neck of the fiscal.
Great. Let me get to you, Harriet. And I start to say that, yes, in the 2021, but I think about page 260 or so, government had indicated that it was going to borrow in, constructing the 111 hospitals. But like you say, let me get to you, Harriet. And this is very, very important, because now we're talking about Agenda 111, and the question is, we are prioritizing hospitals rather over CHIPS compound or primary health care clinics and facilities for capital spending. Is the government's priority well aligned to the needs of the marginalized?
Yeah, thank you. I think the first question we probably need to ask ourselves is that what are the health needs of the marginalized? What health services do they seek most? And how can we provide those services? I believe that marginalized people have preventive as well as curative needs. And so in terms of preventive needs, the CHIPS is the best approach towards it, because then we have the health personnel within the communities moving from house to house as the intention of CHIPS to provide preventive services. And so before you even move to the health facility, it might be once in a while before you get to the health facility itself to seek care. And so for me, prioritizing building 101 higher level hospitals or facilities shouldn't be the priority of government at the moment. We need the CHIPS. In fact, the medium-term development plan framework, which is starting 2022, states that government is going to prioritize CHIPS, so we can move from about 80% or less to a higher percentage of CHIP compounds or zones that we should have within our country. This is to promote universal coverage in terms of access, in terms of the quality of services that are provided people. Higher level facilities also provide services towards universal health coverage. But we should also ask ourselves several questions as to how many of our people can move to the higher level and access the service. I believe that is why government wants to bring the 111. But is that the priority at the moment? What lessons has COVID taught us? When we had COVID, we couldn't even move from our homes to the nearest facility because they were asked to stay away to contain the infections. How about considering e-health? I think in 2022 budget, government allocated just about 7,000 cedis to e-health. And I think that our investment should go to e-health alongside infrastructure, so that you wouldn't need people to move physically to have face-to-face interaction with a physician. But that through e-health, they can still see their doctors, they can still get prescriptions to their medications, and have them in the nearest pharmacy shop or chemical seller. And that is it. You only move to a physical infrastructure when the need is very, very critical for you to be there, and when your doctor has asked that you should be there to have a face-to-face interaction. So I think we should focus more on the CHIPS. We should have more of the health personnel properly distributed so that we can have more of them at the lower levels to provide the very basic services to the people of Ghana.
Okay. Let me get to you, Professor Anyidoho. So, I mean, when Professor Isahaku was presenting his findings, he indicated, for instance, that we're looking at, when it comes to LEAP, we're looking at a target of 350,000 households in 2022. Unfortunately, the budget makes a provision for the 344,000, showing a gap of 5,977. What additional consideration should be taken up to mitigate this shortfall?
What should the government do to mitigate the shortfall? Allocate more money. I mean, if you look at the total allocation to leave, it's less than 200 million. It's 197 million and some change. I was going to wade into the e-levy service charges by comparison, but I'm not going to do that. That's controversial. I mean, obviously, to ordinary people sitting back, it seems like a lot of money, but if you compare it to other allocations, it's not. The fact is that LEAP, to begin with, was already has a very narrow remit, even without COVID coming with its ravages on people's lives and livelihoods. It targets the extreme poor. So if you're just poor enough, you're probably not going to qualify. You have to be extremely poor. And the amounts are really, really small. Just a little over 100 cedis for a household of 3 or more, which beneficiaries have been shown to use mainly for upkeep. And there isn't anything left over for the capacity building that the LEAP program says that it wants to also achieve. So yes, spend more money. And then the question comes, can we afford it? Is there, what about the fiscal constraints? And I think these questions come because we tend to think of the LEAP program and other social protection measures as consumption. They are luxuries, they are charity, right? And I think it comes back to this question of, are we truly trying to, are we really considering that people are at the center of the things that we do? We want to grow the economy, and ultimately the argument is that when the economy grows, then all of our lives will be better. And I think it's ironic to compromise the well-being of people in the process of getting to the goal of having greater well-being for people. So if we stop thinking of this as charity, as consumption, it's not productive expenditure, it is just money that is going into people and they are going to consume it. I think that's where we get these really small allocations. So LEAP to begin with was not adequate, and certainly is not adequate under COVID. And what you need to do is increase the amounts of money that you spend on people, and especially the people that you have identified as being the most vulnerable.
Thank you very much. And let me get to you, Kofi. So, I mean, one of the things that we've talked about over the last few days is the non-availability of textbooks. Professor Isahaku talks about that also. It's been 2 years of running a new curriculum, and we still do not have the textbooks. Kofi, this clearly could affect our quality of education, wouldn't it?
Yeah. The textbook issue is an overflogged horse. It needs no reiterating the fact that textbooks are important. To be honest with you, and on a lighter note, when I saw the Ministry of Education run publications to publicize the WASSCE pass rates recently, government communicators gave reasons why students performed well in this year's WASSCE. And the first among the reasons was that for the first time, every student in senior high schools had access to all the 4 core textbooks. That was when I realized that textbooks really mattered. Because 2 years ago, the Director General of JS told us that without the textbooks, quality teaching could go on. So textbooks cannot matter in senior high schools. And the reverse happen in basic schools. That is the context within which you see textbooks. We haven't learned. If you go to many states in America, when they are rolling out a new curriculum, what happens is that after the curriculum has been approved, they wait for the cohort in school to phase out before they roll out the new curriculum. You don't rush and implement a new curriculum when you don't have the textbooks. But it has been a culture in this country that we will always roll out new curriculum during reforms and then bring a textbook later. You see, if we are talking about transforming education, it also means that departing from certain negative cultures to that culture of putting the cart before the horse cannot contribute to transforming education. And for that matter, we shouldn't have started rolling out the curriculum when we knew very well that we were nowhere close to getting textbooks and that we wanted to follow the old culture of putting new curriculum in the schools without textbooks. I think that schools are struggling. Last 2 months, we were in the field. You go to Zabzugu, you go to Mkwanta South, and you see teachers dictating the study guide, the resource guide. They are dictating to students who can barely string a sentence together. You understand? So obviously, and what makes it even dire is that coming from COVID, everyone was mass promoted from class 3, for instance, to class 4. The teacher in class 4 has 2 duties. First, to do the catch-up for the 2 terms that were lost due to COVID, and then begin the class 4 job. How could you have done all this, doing your differentiated learning, accelerated learning, and at the same time not having textbooks? So I was happy when the minister promised that in Parliament in June, that by September textbooks were ready. We are in December. There are still no textbooks. And I'm told the minister's last appearance in Parliament days ago, he said that they are doing quality assurance. So we hope that there will be textbooks. In the budget, yes, you won't find textbooks there.
Sure.
But I believe the textbooks will be procured from GET Fund. And so you won't see GET Fund in the budget. GET Fund will go to Parliament maybe next month based on the formula, and then it gets approved. So I'm informed that it is likely textbooks will be procured from GET Fund. So even though it's not in the budget, they will eventually. My challenge moving forward is that we are rolling out a new curriculum for junior high schools starting January. And we are likely to repeat the same thing again. And we are not likely to see junior high school textbooks for 2 years.
Okay.
Yes, that's my challenge.
Good. I'll get back to you, Kofi, but let me get to you, Harriet, and still staying with education, because we know 13% of the education sector's budget goes to free SHS. That's a flagship program. But the question is, how does this, the shift to secondary education affect investments into access and quality at the basic level?
Thank you very much. From all we have said, working within constraints budgets and allocating more to a certain level of education means that the others will receive less. Automatically, they receive less. But our medium-term development framework beginning 2022 has some levers. It talks about access. It talks about participation and inclusiveness. It talks about e-learning. It talks about competency-based skills. These are the, as well as financial and educational management. These are the areas that government wants to focus on from 2022 to 2025. And 2022 budget is the starter. And so the question will be, why should we focus all the attention on one level of education, leaving the rest? We know that at the basic level, you have over 5,000 schools under trees, with some in very poor structures. How much are we given to rehabilitating and constructing infrastructure for those who are still under trees? We know the effects of studying under trees, and so we need to pay some attention to that area. We also know that as we have more children entering education at the lower level, from KG, by the time they get to the primary, the numbers have increased. But from primary and JHS, between transiting from primary to JHS, you have the numbers go down. The reason is that most of our basic schools, most of our primary schools do not have JHS. So you have more of our pupils having to trek probably long distances to communities with JHS. and most of them will drop out. The girls especially will stay back, and you don't have the numbers again at the JHS. And you know, when they are done also, transiting to SHS now is solved with free SHS, let me put it that way. But then you would have reduced the numbers already in JHS. So you have a few actually entering SHS. And so even though we are trying to use SHS as an equity measure, so we get everybody secondary education, we are not achieving it because then we have already a number of people who have already dropped from school, and now we have to use complementary basic education to get them back into formal education. If we gave them the infrastructure, ensure that every basic school has a JHS attached to it, and the teachers and the textbooks to go with, majority of them, or all of them, will then transition from basic to secondary. Now we say secondary has even become part of basic. Then they will receive the full number of years of basic education that we need in our country. And so I think that we should get our priorities right as a country so that we get everybody basic education that we have been talking about as a country, rather than paying more attention to one sector or one level of education, leaving the rest. The data is there to show. You realize that in terms of percentages allocation, free SHS gets more percentage, followed by primary or tertiary level. Okay. So the primary level is suffering, and we need to give them the attention they require.
Great. Thank you very much, Harriet. We're getting very close to the end of the conversation. So, I mean, we've looked at all